I'm Peter Block here at TCT 2014 in Washington, D.C. for On the Scene. With me is Deepak Bhatt. No one who is in cardiology does not know who Deepak is, so I'm not going to say anything about him otherwise, but he and I do this wrap-up, and Deepak is going to talk to us about the trials, or we're going to talk to each other about the trials today. Deepak, tell me about PARTNER. What are your thoughts about this long-term PARTNER outcome? 5 years now.
Yeah, the 5-year data were presented today by Samir Kapadia. You know, by the way, you probably didn't know this, but he and I used to be neighbors.
Oh, there you go.
But yeah, spectacular data, and you were part of that study as well,
yeah.
So you deserve part of the congratulations. Spectacular data showing still a significant reduction in mortality that's durable in patients who are randomized to receive TAVR versus those with just medical therapy, which we know for really bad AS doesn't work.
Yeah, the thing that struck me about those data was that, you know, at 5 years, those patients showed how sick they were. Almost 80% did not survive their 5-year follow-up. But for the control group, there was only one that was still alive.
That's right. I wouldn't want to be in that control group.
No,
you know?
And I think the answer is yes, even in these sick patients, it makes you feel better, certainly, and it gives you some survival advantage.
And it's very difficult a priori to know whether you're going to be in that really sick group that doesn't benefit from TAVR. Yeah. Lots of folks want to do it. Few people have figured out how. So I think a patient that's a good candidate for TAVR, we ought to offer it.
You ought to put a TAVR in. There you go. Okay, let's move on. Another trial, ISAR closure. So ISAR closure is an interesting trial. It randomized manual compression against a femoral closure device. Short version here is really quite simple. It was a non-inferiority trial, and the closure device was non-inferior to manual compression. Well, you might say, big deal, so why don't we just compress everyone? Turns out that the closure device not only made coagulation faster and closure faster, patients got up more quickly, all the things that we know clinically seem to be appropriate. I think the answer here is that if you're doing a high volume cases and you need to do a lot of patients, a lot of throughput, a closure device is the way to go.
Absolutely, it helps cath lab throughput, and this study confirms in a randomized trial, which is an important contribution, you know, prior work for the most part has been non-randomized, confirms that we're not creating complications by putting in closure devices. So that's good news.
So I want your sort of thoughts about the core valve issues. 2 core valve trials, Deepak. One, a evaluation of what the cost effectiveness is, and the other, of course, now 2-year follow-up of the very high risk versus surgery in core valve.
Right, Steve Yakubov presented the 2-year data, and it looks great. I mean, what we saw at 1 year, it seems to be holding up relatively low rates of mortality and stroke with that device. So consistent with the overall TAVR literature, TAVR is looking pretty good. The cost effectiveness analysis that Matt Reynolds presented, also very interesting. That was specifically looking at the core valve data and showed that it was pretty cost effective compared to other things that we do in medicine like dialysis and so forth. And I think what's intriguing is that degree of cost effectiveness likely in the future will get better as the cost of these devices come down once there's more competition on the market.
I agree entirely. You know, go back to those 2-year data. One of the interesting things about the 2-year data is the paravalvular leak business.
Oh, right.
You know, the paravalvular leak, moderate PVL, seemed to continue to get better at 2 years versus initially at 30 days, and everyone said, what is going on? No one really understands that, yeah. But it's probably some kind of remodeling or continued expansion or whatever, but it does seem to be real.
And it's not associated with excess mortality
Exactly.
If it's mild or moderate regurg, so that's also good news.
Yeah, but if you have a lot of paravalvular leak, that's not good for you.
That's right, severe, bad.
We'd agree on that one.
Right.
All right, so clean TAVI.
Oh, right. This was an interesting study, relatively small, about 100 patients undergoing TAVI randomized to either receive this embolic protection device or not. And it was looking at MRI of the brain, diffusion-weighted MRI, and found more bad signals if you didn't have the embolic protection device than if you did. So that's interesting and important, and confirms that there might be some benefit to this approach. The study wasn't powered to look at things like stroke, but that would be the next step to see in a larger study whether this sort of embolic protection would actually reduce stroke associated with TAVR. And if it did, you know, that would be a big advance.
Yeah, this device is a windsock device that goes into the innominate on the right and the left carotid. And I talked to some people who did some of those early studies, and they said every time we take this thing out, there's stuff in it. Well, no surprise, right? Stuff goes north. The question really is, to my mind, does it make a difference as far as stroke and heart outcomes are concerned? And I think we just have to wait. This is too small a study to tell us about that.
Yeah, I agree. I mean, intuitively, it should make a difference. In carotid stenting, we know there's a lot of junk that comes out of those filters. But here we're talking predominantly about aortic arch embolization. And as the devices get lower profile, probably that degree of embolization goes down. But there might still be a role for these sort of embolic protection devices.
I think the jury is still out on that one as well. So there you have it for a quick wrap-up of today. 5 important trials and lots of good information. Nothing I would say so far that is world-shaking and different and will change the way we think about things, but the peripheral closure devices may be an important step.
I think so, and just overall for TAVR, I think it's really more positive news. It's just saying TAVR's looking pretty good, even with longer-term follow-up.
I think it's here to stay. Thanks, Deepak.
So.